healthcare is more than just a profession. It is a calling. And at CloudClinic, we believe that the future of healthcare is about answering that call in new and innovative ways. Our platform is designed to empower healthcare providers like you with the tools you need to deliver exceptional care to your patients. With CloudClinic, you can have more visibility, track inventory more effectively, and improve your revenue. CloudClinic provides a convenient access to healthcare, breaking down the barriers that limit access to care, reaching patients wherever they are and whenever they need you. With CloudClinic, you can reach more patients, grow your practice, and focus on what you do best, caring for your patients. But CloudClinic is not just about technology. It is about people. It is about fostering collaboration and innovation that drives better outcomes and changes lives for the better. With CloudClinic, you can collaborate with other healthcare providers, access real-time data, and provide personalized care that truly makes a difference. At CloudClinic, we believe that healthcare is a partnership, and we are committed to being your partner every step of the way. Together, we can transform the future of healthcare and create a world where everyone has access to quality care. So, let us join and revolutionize healthcare with CloudClinic, because when we work together, anything is possible.
Good morning, everyone. Good morning. Welcome to the first CloudClinic Partners Onboarding webinar. Welcome, everyone. Thank you very much. We are very, very glad to have you here. This webinar is for those that have partnered with us and for those that are looking forward to partnering with us. So if you're on the fence about partnering with us, hopefully by the end of this webinar, we would have answered all of your questions, and we would have solved all of the problems that is stopping you from partnering with us already. So kindly drop your name and where you're joining us from in the chat so we can get started. So in the chat box, you can just drop your name, and then you can drop my name is, for instance, my name is Lola. I'm joining in from Lagos. So very quickly, you can help us do that. All right, so while you're introducing yourself, I would like to introduce the panelists for today. I'm going to be starting with my CEO, Mr. Ifeanyi Aneke. Mr. Ifeanyi is the CEO of CloudClinic Limited with 14 years experience working in the technology industry. He has worked for several IT and financial service companies and helped them build innovative products. His work experience spans across international IT and software companies, such as Microsoft, where he worked as a cloud solution architect, covering the Middle East and Africa, in charge of select next-gen high potential accounts in the region. The next person I'll be introducing, which is our second panelist, will be Flourish Unamdi. Flourish is our product manager with over 5 years experience as a business developer and product manager in the financial services industry. He's certified in product management and digital payments by Lafati Group, and he holds a Bachelor of Science in Economics from Landmark University. I'm moving on to introducing our program coordinator, Mrs. Roslyn Uamaka Ezekwesili, our program coordinator with a blend of experience across several industries. And then I'm moving on to the very last but not the least panelist, our clinical director, Dr. Amy Ojako, who has 6 years experience in medical practice and 4 years experience as a health management consultant. Dr. Amy is certified in clinical management of HIV from the University of Washington. She's certified in leadership and management from University of Washington, and she has an MBBS, Bachelor of Medicine, Bachelor of Surgery from University of Nigeria, Nsukka. And also, I'll be introducing my humble self, Ololade Olale. I am the clerical associate for CloudClinic, and I'll be your host for today. So I can see that some people are already introducing themselves. I can see Augusta joining from Lagos. I can see Obidi from Abuja. I can see Uche Okolocha from Sabo Yaba. Good morning. Thank you very much. I can see Egbo Stanley from Enugu. I can see Favor joining in from Benue, Makodi State. Thank you very much. And I can see Dr. Cordelia Itok joining in from Uyo in Akwa Ibom State. Thank you very much, everyone. So thank you for joining. Please note that during this webinar, we'll try to answer your questions. So if you have any questions during the process of the webinar, during the duration of the webinar, you can just drop your question in the questions and answer box, and then somebody will definitely attend to it. I can see someone joining in from Gifts Pharmacy, Chineye Uachiku from Abuja. Thank you very much for joining us. So for those of us that are just joining us, welcome to the second CloudClinic Pharmacy Partners Onboarding webinar. This webinar is designed to help you understand your partnership with CloudClinic better. You will understand how you will get paid, which is very important. You understand our house rules for you as a pharmacy on our platform, amongst other things. So welcome to the first CloudClinic Onboarding webinar. Next, I'm going to be going through the things that you will be learning during this webinar. Please note that you can drop your questions, like I said. Okay, I can see Chika from DoveMed Pharmacy Enugu has joined. So our outline for today's webinar, the first thing we'll be talking about is a brief introduction to CloudClinic. We'll be telling you who a partner of CloudClinic is, the benefits of being a partner, the introduction of the CloudClinic Partner app. We'll be talking about the house rules, of course. We'll be telling you the onboarding process of a partner. So basically from interest to you actually being able to dispense drugs to our patients. And then we'll be answering some frequently asked questions, and also you'll be able to ask your questions as well. So stay with us and enjoy the webinar. So very quickly, I'll be handing over to my CEO, Mr. Ifeanyi Aneke. Mr. Ifeanyi, over to you.
Thank you very much, Lola. Good morning, everybody. We're excited to have you here. I'm seeing all of the people coming in from different parts of Nigeria, Enugu, Lagos, Abuja, and then also from Makodi, I believe. Please, you're welcome. Thank you very much. I'm excited to talk to you about CloudClinic. I'm sure most of you have heard about us already. We're a platform that is building a platform to orchestrate the different interactions in the healthcare sector. That's really what we're about. We're trying to build a platform that is going to really change the way healthcare is perceived today. So it's a medical platform that connects different players in the health industry by providing a solution that works for doctors, patients, and health facilities alike. Now, if you look at this concept, is being tried by different people before now. We know about some of the people, the competition that have tried to build a solution like this. Our approach is completely different, as you are going to begin to find out as we start to dive into this. But let's talk about the vision first of all. So our vision is to provide our vision is to provide access to quality healthcare for everyone anywhere in Nigeria. Now, that's a very tall vision. When you talk about Nigeria, how wide and dispersed it is, when you talk about the fact that there are people that are in different remote locations across Nigeria, you will see how bold this vision is. But we do believe that this is achievable. And if you look at some of the things that are happening also in the country, we talk about like the advent of Starlink, for instance, that has provided internet access across any part of the country. And also with the penetration that's happening, you know that this is possible. Our solution leverages on those infrastructure. So anybody now that has a mobile device can actually access healthcare with CloudClinic from the comfort of their home. As we're expanding and with the partnership that we'll have with you, those things are very, very possible. Okay, so now the question is, how are we planning to be able to achieve this? How do we plan to make it possible for anyone, anywhere in Nigeria to be able to access healthcare without technology. The solution that we have in mind, what we are planning to do that is by engineering the future of healthcare would focus on access and convenience through technology. Now, what does this really mean? What we're saying essentially is that we're building a platform using engineering principles, learning from the different stakeholders like yourself and many other people that we've spoken to in the industry, and trying to understand the best way to create this hybrid solution that is able to really solve this problem for everybody. That's what our mission is, and that's how we're getting that done. All right. So let's talk a little bit about some of the services that CloudClinic Limited is providing. Now, a couple of them. So we're currently running on a cloud infrastructure that is helping pharmacies like yourself and many other stakeholders to be able to really provide very reliable healthcare service to your patients, right? We're also working on smart devices. There are a couple of smart devices that we have that make it easy for a doctor to be able to consult with a patient from the comfort of his home, while the patient is able to really use and understand the device, irrespective of the age and exposure of that particular patient. We're also leveraging on accessibility. So there's a lot of things we're doing with GPS technology to be able to guide the patient from the comfort of his home directly to the nearby pharmacy. So even if they don't know where your pharmacy is, we're able to direct them to your location. And for pharmaceutical companies that for pharmacies that we're partnering with that are providing home sample, home drug delivery, we're also using the GPS technology to guide you to where the patient is located. So these are things we're doing to really make the process easy. If you understand this, you would see that really what we're building is not just an online platform. It's a hybrid platform that brings the two worlds together, the world of online and the world of physical. And our partners are really our bridge to the physical world. We're also working mainly with licensed facilities, right? So we're not doing anything with any facility that is not licensed because we want to make sure that we're providing the best quality care for our patients. And this is how we do that, working with licensed facilities like pharmacies, med labs, and reference hospitals that have the right, licensure. We have a bunch of specialists on our platform. As of today, we have close to 200 doctors in our wait list, working on joining, waiting for us to launch. And there are across different specializations of consultants. We have different people working with us, different doctors, different specializations. So it's really the key thing about what we're doing is really providing this very sophisticated platform that helps our patient, irrespective of whatever ailment they are suffering from. All right, so our partners are our strengths, right? If you look at the slide on the screen, we're really talking about the fact that CloudClinic is surrounded by these partners that are here. We do not exist without our partners. Our partners are very important in how we deliver healthcare to our patients. And that's why we're having this conversation with you today, because we know that you have you have what we need and we have what you need. We have the patients to deliver to you, and you have the physical presence close to our patients to be able to help them be able to get well using your services. So right on the screen here is a couple of facilities that we're partnered with. We couldn't fit every one of them on the screen, and there are many more. We have close to 70 different partners today, pre-launch. And then there are more, reviewing the agreement and getting ready to sign up as well. So what we're doing in this webinar, like Lola aptly explained, is to show you what are those benefits. And I think that's a good segue for the next slide. The benefits that exist for partners in CloudClinic. So who really is a CloudClinic partner? What does it mean to be a CloudClinic partner? Right? To be a CloudClinic partner, you will be a member of the CloudClinic Partners Directory. What does this mean? CloudClinic have spent a lot of money and is still spending a lot of money on publicity and trying to make sure that our partners are visible to the world, right? To your patients, anywhere in Nigeria. So all of those things will provide you visibility, and visibility is business. So that's one of the key things. Being a member of that directory is a very important aspect of that. Now, there's also, our partners are also recipients of the brand recognition that comes with being a partner with CloudClinic. We have this relationship that allows you to publish our logos, and now that relationship exists between the two companies because of that partnership in question. There's also increased trust with increase in customer retention. As partners that are working with CloudClinic are only licensed partners. So by being associated with CloudClinic as a brand, that also automatically transfers that trust, to you. Just the same way, a lot of pharmacies paste on their walls their licensure. This is another way of doing that to show that credibility that your company, has what it takes to be able to practice in Nigeria. Because we have a very rigorous vetting process before bringing any partner into our fold. There's also, in addition to that, there's increased reputation for the partners, and also credibility as well. Now, we also only partner with partners that have, that adhere to international best practices for health standard. So, things like dispensing drugs that are expired or just about to expire, or, following any practices that is not, the right way for either of the facilities, whether it's a med lab, a pharmacy, or a reference hospital. We only partner with those that uphold the best standards. So being a member of our fold gives your patients that, credibility or that understanding that, hey, I'm working with the right partner in this case. There's also a clear mutual support system, and you're going to see this more. I even have an announcement to make today. You see more of that and how that really works between the relationship you have with CloudClinic. We see you as a partner. And that partnership really means that we're constantly looking for ways to increase and make your business better, because we know that your success invariably is our success as well. So that mutual support system is there. There's also a lot of tons of networking opportunities that exist by being a partner with CloudClinic. You are exposed to this very wide partnership across Nigeria, and where you can really work together and learn and improve and make the entire industry better. Of course, we only, like I mentioned earlier, partner with fully licensed bodies, fully licensed pharmacies, and you have to have a licensure with PCN. So let's move on quickly to the next slide, where we can begin to talk about the way that this is beginning to help you as a partner. What are the actual benefits that exist there? So the first one, which I think is a major benefit that adds directly to your bottom line as a partner with CloudClinic, is increased visibility. Once you become a CloudClinic partner, it is clear that your visibility will increase considerably. We have with what we're doing with our media partners, with what we're doing through our social media drives, what we're doing with the different approaches we have and the patients that we have, you definitely will have considerable visibility as a partner with CloudClinic. So let's look at the next one. So the next thing that here is increased revenue, and that comes also from being able to have that visibility. With the visibility that you have, you get your revenue will increase considerably. The fact that CloudClinic also directs patients directly to you using turn-by-turn navigation on their mobile app, there is no way your money that's coming to you will be lost on the way. The patient knows exactly how to get to you. And then in the case where the patient is going with a home drug delivery, you would also be able to find the patient easily and then get paid for that service you're delivering to them. So that definitely is a big advantage as well. Now, access to prompt payment services. I'm going to go a little bit deep into this because we did get some feedback on this and we'll tweak this a little bit. But yes, you are able to get access to payments immediately when this is once you provide value to the patient. Next slide, please. Can you move to the next slide? Now, you also have a wide client reach. Typically, in most cases, a lot of pharmacies rely on a very close niche. So you're only working with the patients that are within walking distance or a short drive to your facility. With CloudClinic, that changes drastically. We can bring in people that are coming on a visit in that location. We can bring in people that are far away from you because they really like the pricing that you have or the drugs that you have. You have much more, increased visibility, and that definitely increases your reach. So it's like putting your signboard 20 feet above the current location where it is today. All right. So this is the most exciting part. I am very excited to announce to you that we're introducing the CloudClinic Partner Wallet. For those of you that were part of our last webinar, there were a lot of feedback from the pharmacies that were there about our plan, or our original payment process that we had before was supposed to be that the pharmacies get paid at the end of the month. The same thing we're doing for the doctors. So that was the model that we had. The feedback we got from you was that it was not going to work very well for pharmacies because pharmacies rely on the inventory that they have, and having to sell those inventories and wait till the end of the month is going to affect the business, the money they use in doing business. And so the ideal thing was that the recommendation was that the payment should be done within 72 hours. Right? What I'm excited to tell you now is that we not only did we listen to what you said, but we came back with a change. We even though we had this planned originally, speaking to the engineering team in CloudClinic, we found a way to expedite this process. And I'm happy to announce to you that the partner wallet system for CloudClinic is going to be available on launch on the 18th of April. So, and what that means is that you will be able to receive value for any medicine you dispense to a CloudClinic patient immediately. Once the patient receives that drug, your money is in your wallet instantaneously. I would, at this point, hand over to Flourish to explain to you the details of this and how it works. But that's definitely one thing that I've heard from you. And it shows how CloudClinic these listings, right? And that's why I talked about partnership, right? So it's not about, we're not only just saying we want to do this just for doing sake. We're listening to the market. We're listening to our partners. We're understanding what we need to do to tweak and make sure that this product comes out working exactly how it's supposed to work. So I see Flourish is already here. Flourish, I'm turning over to you so you can explain this whole process to them, explain to our partners what exactly this app is, how the app works, and how they can use that to provide value to their patient. Over to you, Flourish.
All right, thank you, sir. Thank you. I'll start on the existing protocol. I first of all want to thank everyone for being able to join this webinar. There was something I took note of during the beginning of this webinar, and I noticed that a couple of people were asking some questions. How do we get paid, or how do we update our price? And I want to introduce to you the CloudClinic Partner App. All right. The CloudClinic Partner App essentially orchestrates interaction between you, our partners, and the rest of CloudClinic. So what we've designed today is a simple application so that you can do specific things, which I would also go further down into this presentation. I'll move to the next slide. Now, we understand that today we have a lot of partners who have different facility branches in different parts of Nigeria. Moving to the next slide, one of the things that you can use the partner app to do essentially is to manage your facility irrespective of where that facility is. We've created a robust solution. Can we move to the next slide? Because I think we're still on the initial slide. All right, let me see if I can just, share the presentation on my end. Give me a minute, please. All right, so I'm moving to the next slide. I tried initially to first of all introduce the partner app. So I said essentially the partner app orchestrates communication between you, our esteemed partners, and the rest of CloudClinic. What we've designed today is a simple solution such that you can do specific things using the partner app and also render your services to our CloudClinic patients. One of the unique things about our partner app is we understand that today, all right, a lot of our partners have different facility branches in different locations in Nigeria. We have designed a solution so that you can seamlessly manage your facilities irrespective of where they are, all right? The CloudClinic partner app enables our partners assign facilities to people who they trust, people who manage those facilities irrespective of where those facilities are. And at the same time, as a partner, you can also monitor the operations of that facility using the partner app. Essentially, you're in control of your facility locations and who manages them. I'll move to the next slide. And another unique thing about our app is the activation, all right? One of our unique selling points and our proposition to the market is that we use the GPS technology. We leverage on the GPS technology to serve our vast customers. And one thing with the partner app is that using the partner app, you're able to activate your facility, capturing certain locations, and this communicates precise locations to the CloudClinic app. So using this medium, we are able to directly route patients to you, irrespective of where your facility is located. So we give them turn-by-turn navigation to be able to access healthcare, with your pharmacy. Moving into the next slide. Inventory list upload. I observed that a question that was asked by one of our attendees here that says, how would you upload your drugs or on the CloudClinic app? How would we know the drugs that you're selling? One of the things that we've built in our app, and this also has a web platform to make it easier for our users, is that regardless of whatever template that you use, you can bring your template and our system learns your templates, learns how that template is, and that template is replicated on the CloudClinic app for patients to be able to get drugs for you. So what this means is, if irrespective of the kind of drugs that you sell, you have an Excel template that contains the drugs that you sell, the formulations of those drugs, the prices of those drugs, and you can seamlessly upload that template using the partner app in an Excel format, and the system automatically saves that your template and presents that template to the patient using the CloudClinic app. Moving to the next slide, price updates. I'll say this is another unique question that was also asked. How do we update our prices? And we understand that, due to how the situation of the economy is, prices change constantly. All right, we've developed an easy solution so that using the partner app, you can update your prices. You don't even have to upload a new template. Just visit the app, you're seeing the list of drug items that you've uploaded already existing in the app, and you can quickly update the price of that particular drug and save it. So we made this easy so that so that our partners won't also run at a loss, and at the same time, our partners can also be abreast with the current market changes. Now, we have the notifications and the orders. Essentially, as the MD has already announced, we decided to introduce early the CloudClinic partner wallets. Essentially, how this works is when a patient is sent to your facility location, all right, we send a notification using the partner app that consists of the certain things that you see on the screen. It gives you an information of who that patient is, and it also gives you an information of the items, the medications that have been prescribed and paid for by that patient. All right. So we try to inform our partners early enough of an existing order that has already been paid for. And all you have to do is, once the patient visits your location, you have to fulfill that order by presenting the drug items to the patient. The patient in return provides you a confirmation code, which you impute on the partner app. All right. The partner app accepts that confirmation code and immediately your wallet is credited. So what we've essentially done is that we've built in a system in the partner app so that you can track your orders irrespective of where your facility is located. Using the partner app, you're aware of the number of orders that you've received in a particular period of time, and you can easily fulfill or confirm those orders in the partner app to show proof that this particular patient has already picked up this drug. And it's essential for you to note that once those orders have been confirmed, your wallet gets credited. Now, I would show us a simple flow of how to activate your facility using the partner app. Remember that I said that activating your facility using the partner app will require you to capture certain angles of your facility and certain angles of your facility such that we are able to get precise location of where your facility is. That would enable us to be able to route patients and give them easy directions to locate your facility once they've paid for a drug item. So the first thing you need to do is to visit get.cloudclinic.ng/CloudClinic partner to download the partner app. All right. Once you're a partner with us, we create you on our system back end. Once we create you on our system, you're receiving an email from us, and we also confirm to you via messages, of your partner information. All right. Once you downloaded the app, you are required to enter into the email address that was used to create you on our system by CloudClinic. You enter that email address into the partner app. Once that email address is entered, you receive an OTP. That OTP is just a second level verification to confirm that you are the one who owns that email. Once you put in the OTP, you're presented with the facility information, which we've captured in our system. All right. We want to be sure that the facility information I've captured in our system is accurate so that we will not mislead patients to a different location. So once that information is presented to you, you have to confirm that that information is correct. Then the next thing is, is to capture the, moving into number 6, you capture certain areas of your facility. All right. We've designed the app so that the app also indicates the areas that you need to capture, such as the front of your facility, the entrance of your facility, the reception area, and the equipment or the drug items that you have. All right. So this gives the users, that's the patients in this case, more insight on the facility or the pharmacy that they're going to visit, and where that pharmacy is located. Now, the next is for you to upload your price list. All right. And I've said it before that we've built a solution so that our system learns your price list. Our system learns your inventory. All you have to do is maintain specific columns on your price list, such as the generic name of your drug, the brand name of the drug that you have in your store, the formulation, if it's a capsule or a syrup, and the price. And once you have all this, once you have all these columns, you upload your price list using the CloudClinic partner app. Once you upload your price list using the CloudClinic partner app, it automatically saves that price list on our system. Essentially, what that means is you don't have to worry about any other thing again. If you decide that you want to update your prices, you can easily log into the partner app and just update the pricing. Even if you wish to upload a different inventory, a different price, you don't have anything to worry about, because our system is intelligent enough to still, learn and adopt the new upload that you've made. So once that process is done, you're ready to go. So essentially, this is just an easy step on how to activate your facility. Subsequently, we'll be sharing with you links that's going to contain an actual instructional video that will show you a more detailed process on how to activate your facility and also make use of the partner app. We also love to get feedback from you, and once that video is sent, you can also reach out to us to also share feedbacks using the app. So on this note, I would give the floor to the clinical director, Dr. Amy, for her to champion the house rules, the information on the house rules. Thank you.
Okay, thank you very much, Flourish. Good afternoon, everyone. I would also want to stand on the existing protocol and equally apologize for the network glitch earlier when I was sharing my screen. So moving on quickly to bring this webinar to the last lap of the presentation, I would be discussing the house rules with us. These house rules are mandatory, for the pharmacies, because we all know that every establishment, every organization, they have their rules, governing activities in the organization, right? So we have come up with rules which we expect our partners to abide by. This is because our partners are our ambassadors, right? So our patients are going to our partners, and whatever services that our partners are giving to our patients, it's all CloudClinic, all right? So it's on the basis of that we've come up with these rules to guide the services that we'll be rendering to our patients from start to finish. So moving on to delve into the house rules proper, I'll be talking about the house rules on license. The MD had already mentioned that we are partnering with licensed facilities, all right? So we expect our partners to be fully registered under the Pharmacy Council of Nigeria, PCN, and the Ministry of Health, okay? And also, we know that pharmacies work with pharmacists, right? So for every pharmacy that is established, there must be a pharmacist. So we expect that the licenses of these pharmacists, right, must be renewed as at when due, okay? Can we go to the next? All right, the house rule on identification. The affiliate pharmacy must identify CloudClinic patients' information sent to the facility before rendering the services for which the patient had come to the facility for, okay? Let's go to the next slide, please. Thank you. So the house rules on prompt service delivery. Now, once an order is received, the facility should ensure that the order is sorted and packaged immediately according to the CloudClinic packaging guideline. So we have come up with a guideline to help our facilities partners to render the best services to our patients. So it's expected that the patient's order, the medications are already packaged. I mean, the order is sorted, medications packaged following the CloudClinic packaging guideline, even before the patient arrives to the facility. Okay, so that's, we are hoping for a prompt service delivery. Yes, a patient is expecting a prompt service delivery, and with that, patient satisfaction is at the ultimate level. Also, we expect our partners to ensure that all medications are complete before dispensing. So we don't want a situation where a patient gets to the house and then opens the box, opens the package and realizes that's one medication. Hello?
We lost you for a bit. You might need to go back a little bit behind. I think connection glitched a little.
Yes. Am I back with us now?
Yes, you are.
Okay, thank you. Sorry, my network is really special thanks to Starlinks for really coming to our aid with respect to network availability. All right, so I spoke about prompt service delivery. Right. So once an order is received by the facility, we expect the facility to ensure that the order is sorted and packaged immediately according to the CloudClinic packaging guideline, even before the patient arrives. So we are preaching prompt service delivery. Our patient has paid for convenience, right? So we wouldn't want our patient to come to the facility and to pick up an order that had been sent prior, and then the patient keeps waiting in a queue to pick up the order, right? So pick up the medications. So we developed the CloudClinic packaging guideline, which will be sharing with us, right? And then we expect that our partners will follow the guideline and package these medications, the order for our patients. What we are preaching is prompt service delivery and ultimate patient satisfaction. Also, we want to, it's important that the medications are complete before dispensing. So we don't want a situation where the patient gets to the house after picking up the order or the medications and then discovers that some tablet paracetamol is missing in the box, right? So it's important that the partners go through the prescription lists critically and make sure that the order is complete and well packaged incomplete dispensaries are not tolerated. Flourish, could you go to the next slide? Okay, so we're talking about quality medications. We have seen various cases of fake drugs, ravaging the country and even beyond, right? So it's on this background that we have come up with this house rule that our affiliate pharmacies, our partners, must provide quality medications to CloudClinic patients promptly and without unnecessary delay. I talked about that in the last house rule on prompt service delivery, but the emphasis on this house rule is on quality medications. Okay, we are partnering with licensed facilities, and for a facility to be licensed, the facility must have gone through some due processes, passed through some assessment mechanisms in place, that the Pharmacy Council of Nigeria put up, to ensure that quality service is delivered to patients. So it's important that we are giving our patients quality medications. Fake drugs are not tolerated in CloudClinic. Our patients should not, for any reason, receive low quality or fake medications for any reason whatsoever. Okay, next slide is talking about ethics. The affiliate pharmacy must practice within the ethical guidelines provided by the appropriate authorities, Pharmacy Council of Nigeria, any other, the Pharmacy Society of Nigeria, and other bodies, Ministry of Health. So if we have any concerns concerning the house rules or any concerns whatsoever, we encourage the partners, our partners, to mail the concerns to our email, partnersupport@cloudclinic.ng. Let's go to the next slide. So this slide is on monetary remittances, and the MD and Mr. Flourish did a good number on explaining to us that our money is coming in as the patient is paying, and the order is sorted, delivered, or picked up, and order confirmed. So partners are required to confirm dispensary of medications to patients on the app. So after you have given the patient the medications or delivered to the patient's house, as the case may be, you confirm, we encourage you, we require that you confirm dispensary of medications to the patients on the app. And then the agreed markup or the rebates which we sign in the partnership agreement will be deducted from the funds and balance remitted to the affiliate pharmacy wallets. Withdrawal from wallet attracts bank charges. Let's move to the next slide, please. So this is the last slide on confidentiality. So those of us in the health sector, we are very much conversant with confidentiality. And CloudClinic Limited has brought, confidentiality up to the topmost level, because we must respect our patients' right to confidentiality. Okay, there are confidentiality clauses in various guidelines in the health sector. So it's important that we abide by the rules of confidentiality for our patients, because it is their rights. Their privacy must be respected as stated by law and in the partnership agreements which we both signed. Let's go to the next slide, please. Okay, so here we are at the link to the house rules, which can be found here. Also, we have the link to download the partner app, and then we have the link to
All right, I think
apply
Dr.
to be a
Amy
licensed
still struggling with our connectivity.
Am I off again?
For a bit. No, continue.
Okay. All right. I mentioned all the links we have, the links to the house rules here, the links to download our partner app, and the links to apply to be a licensed partner. I'm going to rush through the frequently asked questions at this point, but before then, we are glad to inform us that our launch date is on the 18th of April, 2023. And it's if we way to that, because we are very much expectant. I know you, our partners, are expectant too, and we've been working so hard to make sure that we bring you the best products on the 18th of April 2023. Okay, let's go to the frequently asked questions. That's the last lap of this webinar, right? Over the time while we've been interacting with our partners, we've been asked several questions, and that's made us to bring them out and then discuss them in details in this webinar. The first one is, when will I get paid for the medications I give to the patients? The patient pays for each medication before dispensary. Just a moment, okay. And the total fund remitted to you once order has been confirmed as delivered or picked up. Let's move to the next question. How will I get paid? So the first one is, when will I get paid? This one is talking about how I will get paid for the medications I give to the patients. CloudClinic will credit your wallet in the app once an order has been confirmed as delivered or picked up. And from the announcement that was made, hey, we are happy to inform you that you can draw down your money at any time. Let's move to the next slide. How will I recognize a patient from CloudClinic? Now, a CloudClinic patient is coming to you with a prescription, all right? And then you also have details of the prescription list sent to your email and indicated in your app. So with that, you can confirm the identity of the patient coming to you as a CloudClinic patient. Let's go to the next slide, please. How do I update the price list? Price lists can be updated through the CloudClinic partner app by updating them one by one or uploading the new price of your service using an Excel. And like the product manager mentioned, you just come in with your price list, and then our app takes care of it. What happens when a patient wants to procure a medication outside the prescription list? Any patient reserves the right to request for medications that are not prescription medications. We all know that with prescription medications, we can't just, dispense them without doctor's prescription, but we are free to dispense medications that are not prescription medication. So if a patient comes and says, hey, I want paracetamol, but it's not in this list and it's not a prescription medication, by all means, you can dispense the medication to the patient. However, any prescription not marked as paid will be paid for by the patient. Let's go to the next slide. Okay, how frequently do I receive my money as a CloudClinic partner? You can request for withdrawal anytime, as CloudClinic pays her partners immediately the patient receives value. All right, this is self-explanatory. Must I upload my price list on the CloudClinic partner app? Yes, however, the app allows you to use a desktop browser to resolve conflicts during upload. Let's go to the next slide. So at this point, I would take the questions from the audience while thanking you all for listening to us talk about CloudClinic and the benefits, and run through the partner app, run through the house rules, and take the questions, the frequently asked questions. So thank you very much for listening. We have our, can we move to the next slide, please? Move to the next slide. Thank you. All right, so we have our social media handles. We are on Instagram, CloudClinic Limited. We are also on Twitter, CloudClinic, and we are on Facebook, CloudClinic Limited. We have our WhatsApp number that you can chat with us live on WhatsApp. And then we are on LinkedIn to CloudClinic Limited. And then we have an email presence, supports@cloudclinic.ng. And finally, we have our website that would encourage you to visit for more information, www.cloudclinic.ng. Thank you all very much for listening as I hand over to Lula to continue hosting us. Thank you.
All right, thank you very much, Dr. Amy. Thank you for the insightful presentation, Flourish for the presentation on the partner app, and of course, our CEO. So we've had some questions, and what I'm going to be doing is I'm going to be reading out some of the questions we've had. So there's a very long one here from Samson Chukwu. I'm going to be reading this out, and then I'm going to be I'm going to let our CEO address these concerns. So this is
Lola, hold on, please. I think Samson is raising up his hand. Maybe we can give him allow him to just ask the question himself, and if he wants to do that, because he's raising up his hand.
All right. Can you also kindly give Samson the permission to speak? Thank you. All right, Farm Samson, you can unmute yourself to speak.
Okay, can you hear me?
Yes.
Yes, I can.
Okay, good afternoon.
Good afternoon.
Samson Chukwu from Negus Pharmacy.
Okay.
Okay, my question is concerning the uploading of the drug list and the price list. We've had experience with this before. I can't really remember the app, but I know it has to do with this CloudClinic stuff, about doctors, online. And I think it will be more tedious for pharmacies to upload their drug list and the price list, especially in this time. This time we have economic instability. Like I can assure you that prices change every day. So, for example, let's say that Negus Pharmacy uploads its drug list and price list. For example, I know Augmentin has not had a stable price in the past 2, 3, 4, 5, 6 months. And I give you a price for Augmentin at 4,000, and a patient, you are consulting with a patient and you bill a patient with 4,000 naira. And when the request is coming to me, maybe I've not had time to update the price on the CloudClinic app, and the request is already there before me at 4,000. And probably Augmentin may have climbed to 5,000 or 6,000. So how do you resolve that? That's number one. Then I feel it will be a tedious task for pharmacies to be uploading the drug list and even the price list. So for me, my suggestion is there not a possibility you can have a drug list based on your clinical scope? For example, if you are running a cardiovascular facility, you already know the list of drugs that you work with. And you can now say, okay, I work with amlodipine. You work with rosuvastatin. You upload it. So when a request comes to a particular pharmacy, the pharmacy can send back to you. You requested for amlodipine for this patient, Ada. I can now say, we have amlodipine 10 milligram, Novax brand. Look at the price at that moment. Then you accept, or the patient accepts, whatever you want to do it. Somebody accepts it and they make the payment. One, you solve 2 problems when you do that. You solve the problem of pricing and you solve the problem of availability. Because if I upload my list, another issue I have with the uploading of list, I can upload my list, but when a request comes, it may have been that I ran out of Augmentin, but I already have a request from CloudClinic. How do I sort it out? So I think that's my suggestion. I think with the experience I've had in the past concerning this, I think if it's possible, you guys should have a drug list based on your clinical scope. Then a pharmacy can now tell you the brands he has when a particular request comes with the prices calculated immediately. So you people can accept or reject. Once you accept, at least you're sure of one thing. As the patient is going to that pharmacy, the drugs are there. There won't be incomplete dispensing. Then there won't be issues of pricing at the same time. So I think that should be looked into.
All right, thank you very much, Mr. Samson. I would give my CEO, Mr. Ifeanyi, the opportunity to respond. Mr. Ifeanyi, over to you, please.
Yeah, thank you very much, Lola, and thank you, Samson. So those are very legitimate concerns, and we've had conversations similar to this, where different pharmacies are complaining about the difficulty in being able to maintain their pricing on the app, which also means on CloudClinic, because of the changing of prices, the instability in the markets today. I can tell you what we've done to be able to make that process a little easier. So what we've done is, first of all, we made it possible for pharmacies to be able to upload their price list as an Excel sheet, right? And what we've done is that upload of price list, first of all, we have a list of drugs, like you suggested. We have what we call our master list, which is what the patient uses to, what the doctor uses to do prescription. But we also want to have the prices for these drugs, because what happens is that the patient decides which pharmacy to go to based on the pricing. We also know that there's a possibility that you're not looking at your phone at every point in time. And so there might be some challenge with you being able to respond quickly when those requests come. And some of the times, these drugs are things that require prompt attention because the patient is sick and you need some help. So in all of these things, what we have done is that we've made it very, very easy for that upload to be done. So there is, when Flourish was talking, he mentioned about bring your own template. And so what that means is that we're not asking you to, keep two different templates as a pharmacy. We're asking you to use a template. What is an Excel sheet that you're using to maintain your pricing today? You can use the same template on CloudClinic. What you need to do is just indicate which of the columns is generic name, which of the columns is the brand name, which of the column is the price, which of the column is the formulation. Once you indicate all of these things, right, and also the strength, our system is smart enough. We're using some algorithm to be able to tell exactly which, so even if there are discrepancy, for instance, if you were naming your formulations, it's slightly different, or maybe even the drug, slightly different from what we obtain in our master list, our app is able to understand those differences. And so once you resolve them, you won't have to do that again. So you don't necessarily have to be going every to look at the drugs one by one to be updating the prices. You can just come in the morning and upload your price list. Once you upload that price list in the morning, your price is updated for that day. The next morning, especially if things change often, you can do that every morning. Just upload your price list and then you're ready to receive customers for that day. With what you've said now, we're also looking for ways to make this work. Right? In all honesty, I understand how painful that can be. But I also understand that most pharmacies would always have an idea of the price they're selling things in a day. So once you have that conversation with your with the pharmacist working with you in the pharmacy and say, hey, this is the price for this now, we expect that, that morning when those conversations happened, that should be uploaded. What we have done is to make that process very, very easy. You don't have to change anything. Just upload the same sheet you're using to track prices in your facility into our platform, and we'll take care of the rest for you. I don't know. Do you think that would help in some way, Samson? Does Samson still have his mic on? It does.
Okay.
Yes,
Yeah.
it does.
Yes, I hear you now, Samson.
Okay. Okay, from your answer, another area I have issue. A lot of pharmacies don't have their drug list in an Excel sheet. That's why I'm telling you it's going to be an uphill task. Like I can print out my drug list. I don't have an issue. If you demand for a drug list now, I can give you a drug list. But the issue I have here is that my drug list now is not in an Excel sheet. So what it means is that over 100 pages of drug list in an A4 paper. For me to do that, I will need to come and start putting each and every one of them in an Excel sheet. And you can imagine the kind of tax that will be.
Yeah. So let me ask you, because it's also good for us to get an idea of how you're working today, because we really want to build this to make sure it works for you. So this list you have you printed it out. Where did you print? Was it in a Word document on your computer, or how is it How are you storing it to occupy? Because I'm assuming if it's changing often, it means you have to print it a couple of times to give to the salespeople within the pharmacy. Am I right?
No, what we do is that we have a software, and most big pharmacies do that. You have a software you're using. If you want to change price, you change the price on the software. Once you click update,
Beautiful.
automatically everyone's selling. Once he keys in that product, you will sell at the new price, the updated price. So if you want to print, you print from the software. But what I'm trying to say is that the printout will not come, it will not come in an Excel format. It will come in the software on an A4 paper. Do you understand?
Excellent. Yes,
It's
no, I get that.
That has to do with the software. Updating on the software is not an issue. Just once you pick a particular product, you see the current price. Once you change it and click update, it's already updated. And then you don't need to print and give your staff for them to know the new price. No, once it's updated, once they key it in at the point of sale, is a new price they will be seeing.
Excellent.
Do you understand?
Yes, I get you clearly, Sam.
My concern now is if there is any way the drug list on the software can be converted in an Excel format, there is no issue. But the issue I have is, how can you convert the list of these many drugs in an Excel format? The only way you can do it for me, for the one I'm using, is to start picking that drug one after the other and be putting in an Excel sheet.
Samson, can you share the name of the software you're using? Because I don't know if you listen to my background. I've been working in IT industry for a couple of years. So I know that most inventory solutions has an export feature that allow you to export it into a CSV format or a Excel format. So maybe you can share the name with us. We might be able to help you with that process.
Okay, the name of the software is Dalino System.
Dalino Systems.
Yeah, Dalino Systems.
Okay, so I think you registered for this webinar, so we would definitely have your contact. If we need more information on this, we'll come back to you. But what our plan is for pharmacies that are not using Excel sheets, that have a system, that they should use the export feature in their solution to export their inventory and just upload that an inventory into our system. We're not expecting you to have to do that one by one. That's too much pain. Yeah, so we'll look at what you have in Dalino, and then we'll see how to help you integrate that with our system. Okay?
Okay.
Thank you. All right, Lola, I think we have more questions, right? And I think Buchi is also raising his hand.
Yes, so there's somebody called Buchi raising his hand. Can the host please give him permission to speak? Buchi is a OBD. All right, Mr. Buchi, you can go ahead. Yes, I can.
Good afternoon, everybody.
Good afternoon.
Okay, yeah, so sorry, I came in quite late. I was so busy and I had to, even as I was driving out to be listening, was having distraction based on calls I need that is coming in between. But the question I want to ask is this, though I did not start from the time, and from the few I've listened is a good one. And even a colleague that asked a question is also a good one. For we that did not start on time, is there kind of a place or maybe send it to our mail or phone that will go through it? I'm talking about the slides. Then if there are questions we'll have, maybe if there's a platform, maybe a group could have to ask various questions. For instance, maybe there's something I'm not able to encounter now, maybe in a process, maybe as I'm reading this stuff, I'll be able to get a question that I can put it into an WhatsApp platform, and the question can be answered. So what I'm requesting is a kind of send the slide to our various emails or WhatsApp, and also have a kind of a group that if there are questions we need to ask, they'll be able to ask in that group so that the answers can be we can get answers immediately. So before this, I think we are in kind of a trial error. Though we'll have a kind of some of these, as a colleague I've raised, like Doctors Without Border, we'll have some of them too. But this one is a kind of a quite new, because this one is that you have to upload your prices maybe often. as he already said, instability now. I think this morning, companies send their email about the new update on pricing. So I think the way it's happening is like it's coming every now and then. So we can also keep abreast of the new prices by uploading them quite often, or maybe so I won't have clashes. I remember when I was using a price tag, and I didn't have a steady light. Maybe I've not acquired a solar system. We try to put a price tag and also use system in case if there is a power failure. Will you look at the price tag? Sometimes, based on the stuff, where you're not always there, or most times you might not be there, and a customer walks in and look at the price tag, and they're telling the person, this is a newer price on the system, and if the staff have not changed it there at the moment, it's not having an issue. That's why I'm bringing in this question is that maybe a patient, on the other hand, might see not yet uploaded, depending on the pharmacy the person wants to get his or her drugs from. They have not uploaded the latest price, and the person have in mind of this price is what I'm going to get at this. And when the person calls and maybe having a feedback of, no, the price has changed as of a few minutes ago, it's also somehow bad. And it's somehow, the economy is biting. Everyone is trying to get the cheapest aspect of the drug or commodity so far. So in terms of uploading every morning, you might not upload, or maybe you might upload it this morning, and the company gives you a feedback maybe in the afternoon, and you have a request already that has a patient needs, while have not uploaded the latest price yet. How will you now interface on this aspect? I'm talking about the same day, like today, you have done your update in the morning, and the company now sent maybe later in the day, afternoon, their newest price, where you're updating it. Will you be sending it up, doing the update every now the company send their new prices? So these are my questions. I think that are in 3 phases.
Yes. So thank you, Buchi.
Thank you very much. Yeah.
Thanks a lot, Buchi. I think I noted some of those questions, and then Lola, let me know if I missed any of them. The first one about sending you the link to our materials. Yes, we will. For everybody that registers for this webinar, we're going to email you a link to the presentation. We'll email you a link to the house rules. We'll also email you a link to the video as well. So there's a demo video that we're going to send you a link to. And then we're also streaming across different platforms right now. We're streaming on YouTube, we're streaming on Facebook. So if you go to YouTube on Facebook, you would see this particular webinar right now is recorded. So you can actually listen to everything again, whatever you have missed, because you were on a phone call. So everything is going to be provided to you. If you go to our social media handles, you can also reach out to us from there. We have WhatsApp. So if you can we go back to the contacts slide, Flourish, so that they can see that? I think it's also pasted on the chat right now, the different different social media handles that we have. So you can reach out to us on any of these platforms. You will be able to see. Okay, I think it would just got reposted right now. So you can see the website, the Instagram, the Twitter. Let's include the look at the WhatsApp number is there as well. So you can reach out on any of this platform to us to ask more questions after you receive the email. You can also reply that email, and then we'll be able to respond to you with any question that you might have. So that's on the first one. The other question that you asked is around the issue of price. I think it's very similar to what Samson was saying earlier. So I have a question for you around that, Buchi. You talked about Doctors Without Borders and how they constantly changing prices. So the question I have is, how often does this price change for you? I'm just trying to understand so we can see how this can be done. From your experience, right? How often does those prices change in the past 1 month or so? Can you explain that to us?
Hello?
Yes, I'm with you.
Okay, you're with me. Okay, for instance, I know I receive mails every week of different companies. We have 1,001 companies.
Yes.
Yeah, 1,001 companies. It doesn't come all of them all together. different companies might decide to change their own at the end of the month, while other people decide to change their own at the end of the month. While often, when you make an order, the price of changes, or maybe a rep comes in, this price is no longer the price it was, depending on a particular product. So that's what I'm saying. You can't, since last year, I've not had a steady price. Even I've lost count. I can't even tell somebody. If you ask me, what's the price of this? I'll tell you, give me a minute. I have to go back to the system and check. So I won't tell you above what is at the current price or below what the current price is. So it has not really been stable since last year. Since last year, it has not really been stable. I think I get every now and then, I think on weekly basis, different companies with their different new prices.
Got it. Okay, so Buchi, I think the solution to this is really to update it as soon as those prices changes. Unfortunately, there is no way our patient will be able to know the price that you're selling in your pharmacy if you don't update it on our platform, because we're listing your drugs on the platform, and the patient needs to come in there and then decide whether he's buying from you or from someone else. Also, because the patient has to make a decision to say, okay, this paracetamol that is 1 minute away from me is this amount, and then this other one is this amount. So they have to make that decision to say, okay, I'm going to buy from this. I'm going to walk a short distance and buy from this pharmacy, buy from Buchi Pharmacy and things like that. So we need to know that price. What we have done is what I tried to explain to Samson, to make it a lot easier for you to update that price seamlessly. So you're using the Excel upload, you can also update a single item on the app, search for the item and just update the price there. You don't have to upload the entire Excel sheet. So those things are there, but there is also something we're working on. It's not implemented yet. We won't be going live with it on the 18th, but that is a feature that will allow us to be able to plug into your inventory directly. So what that would mean is that you don't have to, the way you say you go and check the price, right? Once we release that feature, we'll be attaching that to your inventory system so that automatically it will sync up and your price will always be updated. So you're updating only on your inventory, you don't have to upload and import. So when we're looking at that, we'll start supporting different inventory systems. I don't have a date now. It's something that we'll have to do further down the line. But that's the goal. The goal is to constantly keep reducing the friction that you're having in being able to really deliver these services to your patients or to our patients. But for now, unfortunately, what we have now is that you have to keep that list up to date by uploading that as much as you can. Okay?
All right. Thank you.
Thank you, Buchi.
Yeah,
Lola, do we have more questions on the chat or maybe?
Yes, some of the questions have been answered, but there are some that I would just like you to maybe expatiate a bit on. Okay. So one of the questions we have here is, can online pharmacies be part of this?
Yes, certainly. So let me be sure I understand. So online pharmacy, my understanding is pharmacies that have an online presence and possibly partnering with other pharmacies in different outlets, and they are providing that orchestration. So if you order from them, then they find a pharmacy close to you to deliver it to you. The answer is yes. So we can partner with online pharmacies. There are a couple of them we're speaking to at the moment. There are different things that will determine how that relationship will be. So it's not as straightforward as the conversation we're having with you today. So if you have an online pharmacy and you're thinking of partnering with us, please just email us at partners@cloudclinic.ng. It's there in the chat. Reach out to us, and then we can schedule a meeting to understand how you work and explain to you how we work, and we'll see how that relationship can exist. But we're open to that partnership, yes.
Thank you. I have a question here from Rufus, who says, how can a med lab buy into this? Your conversation have been on pharmacy only.
Yes, the reason for that is because this particular webinar is specifically for pharmacies. We have another onboarding session or another webinar on Friday. for med labs. We've done one before. We're doing another one on Friday. So if you're a med lab or you own a medical laboratory within Nigeria, please sign up for that. You can find out, follow us on the social media handles. We'll be releasing the links and how to register for that particular webinar by Friday. But yes, we're definitely partnering with both pharmacies, med labs, and hospitals, specific hospitals in different locations as well.
Okay, thank you, sir. Somebody says, can the pharmacist counsel the patient with regards confidentiality?
So I saw that question and don't fully understand it. I don't know if the person is here to expatiate, but I can try to explain that a little bit. Yes, if a pharmacy can definitely have a conversation with our patients. And if you're counseling in terms of confidentiality, I don't fully understand what you mean by that, but you can have a conversation with the patient. You should explain the dosages of the drug you're giving to the patient. It's part of our packaging guideline. So you will see all of those details on how we expect you to do that, how we expect you to write the dosages and the administration on the packaging of the drug you are giving out to the patient. And you should also have a conversation with them to say, hey, this is how you take this drug. These are things you should avoid and things like that. So it's welcomed. We want this to be, you treat them, as even better than you're treating a walk-in patient. So that should happen. But if I haven't answered this well, and there's something else you mean by confidentiality in this case, I want to, if you can just ask, put another follow-up question, or just raise your hand and we can enable you to talk about that.
All right, thank you. There's a question here that says, can you explain on payment/withdrawing from wallet patterns, please?
Okay, so what we said, we're talking about how can you withdraw from your wallet. So that was the new change. So if you were in the last webinar, we've updated our communications on this, because the partner app today would allow you to be able to withdraw from your wallet. There was no wallet before. In what we had before. The original thing we had before was that partners would be paid at the end of the month. But the feedback we got was that this is not going to be good for partners, especially for pharmacies. Pharmacies were the ones that were really, talking about this, because they're selling drugs, they're selling goods, and that will be tying their money down to wait till the end of the month before they get money. And they might need to go and restock in the middle of the month. Because of that, we made some changes on how the app works, and that required us to introduce the partner wallet system. And what the partner wallet system does is that it allows you as a partner to get your money immediately you hand over the drug to the patient. There's a process for that. You have to get a code from the partner, from the patient, input that code and use the code to confirm the order that you got. As soon as you confirm that order, your money will be credited to your wallet, and you can withdraw that money from that wallet immediately. So that's what we built. So once the patient, hand the patient the drug, the money is in your wallet, and you can withdraw it at any point you need that money. So that solves the problem of having to wait till the end of the month. That's what the wallet system is about.
Okay, I'm going to be asking this last question. Igwe says, what if I don't have one medication on the prescription?
What if I don't have
one medication? What if I don't have one medication on the prescription?
One medication on the prescription. Yes, if you have multiple medications on the prescription. Yes. So the way it works is that we're going to be using your price list to know the medications that you have. And then we would send patients to you if you have the particular medications that they are looking for. If you get a couple, you should, most of the time, if the patient needs more than one drug, there will be more than one medication in the prescription. And what we expect for you to do is to prescribe those, to dispense those medications to the patients. I don't know if that answers the question. I think Igwe's hand is up as well. So maybe we can take this as a last audio question and then we can wrap up.
All right. Would you kindly give him the permission to speak?
I think he has done that. So Igwe, you can unmute yourself and then you can speak.
Okay, good afternoon, everyone. I asked the question on confidentiality, and that was because, when they said confidentiality, I said, are the patients aware that according to the ethics of our practice, before any medication leaves, he needs to know that he has to be counseled on proper use of that medication, so they don't see it as an infringement that just feel, because in practice, this is what happens when they come with a prescription. They just tell you to feel that it's a doctor that wrote this thing, it's a doctor that wrote this thing. Even when you're trying to explain, they say, don't worry, just give it to me. So I hope they are aware so that we do not have any problems with our patients, because initially, that was why I asked the question is if we can counsel patients based on this, the CloudClinic. Then the second one on a medication, yes, that if a prescription has various medications and just one. So I think the issue of updating will solve it. But then I've had an issue of where someone says, I want this, but before the person arrives at the pharmacy, it's already been sold out. So, and I will now have to try to pacify the patients with. So that's why I said, what if a situation like that comes out that, okay, maybe in the morning I've uploaded my price list, but before a prescription arrives, that particular item is no longer available.
Okay, I'm going to allow Dr. Amy to handle the first question on confidentiality with the clarity that you provided now. But for the second question about the issue of drugs being sold out before the patient arrives, what I would advise is this, right? Until we get to a point where we can actually plug directly to your inventory system. Once there is an order sent to you, right? Once there's an order sent to you from our app, we require that you package that drug and keep it for the patient. So that will help reduce that instance. So if the patient takes, a couple of hours to come to you, you know that you've already kept his drug apart. But then you also should know, have an idea of your reorder numbers for your drugs. So your inventory should have reorder numbers. So if you have paracetamol and then you see that it's running low, you get to maybe, I don't know, 5 sachets remaining. Maybe that's at the point you have to reorder to make sure that you have those things in stock. Unfortunately, we don't have a way of tracking that in real time with what we have today. The inventory integration will solve that, because what that would mean will be that we would always be in sync with what you have in your store. But for now, I would say this top gap for now is that you only include in CloudClinic the items you are sure you won't run out quickly. So if you check in the morning and you see that you have only one item for one sachet of paracetamol, you might maybe not include it in the list you're putting up for CloudClinic. And then once you restock and you have a good number, you can include it. I think that's the only way I think we can resolve this, because there's no technology way to do that without integrating directly with your inventory. I don't know if that part makes sense. Igwe, are you there?
Yes, it does. I'm here.
Okay, beautiful. Dr. Amy, are you still with us here?
Okay, yes, I'm here.
Okay. Please take care of the first one.
Okay, thank you, Igwe, for the question. I'd like to provide more clarity on that, right? So the pharmacist is the healthcare professional, right? The pharmacist, the med lab scientist, the doctor, the physiotherapist, and the host of them, the nurses, they're all healthcare professionals, and they are entitled to patient information. All right. So the confidentiality we are talking about is a situation where one takes patient information outside of the healthcare professionals. So within the healthcare system, you as the pharmacist, you're still managing that patient with the doctor from your your own end, which is prescription of medications, discussing drug-drug interactions, the dosages, side adverse effects, and the rest of them. So
I think Dr. Amy's connectivity is not really very great today. But I don't know, Igwe, I think she has already kind of explained this in great depth already.
Yes, so I understand now. I understand now. I just wanted that clarification.
Okay, because you already know what that drug is for and how to take that medication. My network cut me off. Oh, yes, my God.
Did it again.
Oh, and I've been talking now this one. I don't know if I was able to answer.
Yes, I think you were definitely able to answer the bulk of it already. She's gone off again. Lola, over to you.
All right, thank you very much. I think we've been able to answer all questions. Some of the questions were answered by Amaka, so everybody can read those questions in the question and answer box. But I think I've been able to read out most of the questions as well. But for the very last one, I'm just going to read this last question and then we're going to be wrapping up.
But I was talking about.
All right, keep going.
All right, so I'm going to be wrapping up with the last one from Abubakar Musa Mohammed, who says, can a facility have a role in mobilizing potential clients / patients for CloudClinic, and in what ways?
Yeah, so we definitely see this as a partnership. We don't have any problem with you sending walk-in patients to us. So if there's a walk-in patient that comes to you to say they need help with, they need to talk to a doctor or they have something they're worried about, feel free to refer them to CloudClinic. In fact, with every single partner that we sign up with, we will have our marketing materials with you so that you can paste them on your wall. The patient can come there, they can scan the QR code, they can download the app, and they can start consulting with our doctors, our list of doctors. So we welcome that. It's not a problem at all. Feel free to refer a patient to us. And then it's a win-win. When you refer the patient to us and we consult with the patient, because the patient is already with you there's a big tendency that he will definitely be coming to you to buy the drug recommended by the doctor in that process. So yeah, it's a welcome development for us to do that.
All right, thank you very much. So I think that will be all. So we'll be rounding up the session now. Thank you very much for staying till the end. Thank you very much to our attendees. I'm using this opportunity to say thank you to our CEO, Mr. Ifeanyi Aneke, our clinical director, Dr. Amy Ojako. Our business development manager is working back end as well, Ejiro Pepe. We have our digital marketer, Miracle, who managed to put all of this together. Our product manager, Flourish Unamdi. I'm also using this opportunity to say thank you to our engineering team that have been working very hard to make sure that we fulfill our promise to launch next month. So thank you very much, everyone. Thank you for taking the time to join and enjoy the rest of your day.
Thank you, everyone.